Welcome to the Deep Dive. Today we're plunging into something that, well, trips up a lot of businesses. Workplace alcohol and drug policies.
It really does.
And if you've ever wondered, why these policies sometimes fail or what you actually need to do besides just writing a document, this deep dive should help.
It's definitely a balancing act, isn't it? You're juggling legal risks, looking after your people, and keeping things safe operationally.
Exactly. And our sources show it's not just about liability for companies. It's often the financial hit.
Oh, absolutely. Those hidden costs, people off sick more often, accidents, productivity just
Yeah.
dipping, it all adds up.
Right. So our mission today is to kind of give you a shortcut through this maze. We'll look at building a solid policy framework first.
Okay.
Then the implementation steps the bits companies often miss. And then, really importantly, we'll take a critical look at why drug and alcohol testing itself might not be the silver bullet people think it is.
Sounds good. So starting with that foundation, why have a detailed policy in the first place beyond just, ticking a legal box?
Yeah. Well, yes, it covers your statutory duties, but the research suggests it does much more. It's about shaping the workplace culture.
Right. How so?
When procedures are clear and transparent, morale tends to go up. People feel safer, they feel valued.
And that probably helps the company's image, too.
Definitely. It shows a real commitment to safety and welfare. Good for attracting people, good for public trust.
Makes sense. And for that policy to actually work, the source material is pretty clear. It needs backing from the top.
Completely. Strong, active support from senior leadership, that's non-negotiable, apparently.
So before you even draft anything, HR and occupational health need to make that business case to the bosses.
That's the first step. Get that C-suite buy-in. Otherwise, it's likely dead in the water.
Okay, so leadership's on board. What's next for actually putting it together? It's not just writing rules, you said.
No, it needs a proper organizational audit first. But the recommended step before that deep dive is setting up a working party.
A working party? Who's in that?
It's crucial, apparently. You need everyone involved. Trade unions, safety reps, occupational health, safety professionals.
So you get input from all sides.
Exactly. The idea is the more workers are involved in shaping it, the more they trust it and take ownership. That trust is key to making it work day to day.
Right, that buy-in from the ground up. Okay, so after the working party gets going, you mentioned this workplace audit. What does that involve? Misuse is often hidden, right?
It is. So this audit has to dig deep. It looks at the hard data for absenteeism patterns, accident reports, early retirements, disciplinary records. You're looking for red flags.
Standard stuff.
Yeah.
But you said there was more.
Yes. The crucial bit, the part often missed, is what the source calls a process audit.
A process audit. What's that focusing on?
It looks at the system itself, stress factors, things like unrealistic workloads, intense concentration needed for long periods, weird shift patterns, chronic fatigue.
So the things that might lead someone to misuse substances as a coping mechanism.
Precisely. The thinking is, if you can fix those systemic pressures, you might reduce the underlying cause of the problem.
Interesting. Addressing the root cause, not just the symptom.
And then there's the cultural audit, too. That sounds a bit vague.
It needs to be specific, though. Like, is alcohol ever consumed on site? Even socially? What about lunchtime drinking? Is that sort of accepted, even unofficially?
Okay, so the unwritten rules.
Exactly. That culture sets the real standard. You can't enforce a strict policy if the everyday culture kind of ignores it or even encourages borderline behavior.
Got it. So after all that auditing, you finally draft the policy.
No.
It needs to be clear, right?
Crystal clear. And linked up with other policies, sickness absence, disciplinary procedures, they all need to connect.
And the draft itself, what must it cover?
3 core things. 1, why the company is concerned about misuse. 2, clear rules, what's okay, what's not. 3, the procedures for handling issues. And importantly, who is responsible for managing the policy, a designated owner.
Right, accountability. And then before you launch it.
Training. Crucial. Not just an email with a PDF attached.
No. Managers need specific training on spotting signs, handling conversations fairly. Workers need to understand their rights and responsibilities.
Exactly. An unknown policy is basically useless, maybe even a liability.
Okay, so the policy's written, people are trained. Now let's talk about the sharp end, testing, starting with pre-employment screening. When is that actually justified?
It comes down to necessity and proportionality. Is it truly needed for the role? Usually that means high-risk, safety-critical jobs.
Like transport. Airline pilots.
Exactly. Oil rig workers, train drivers, places where sudden impairment could be catastrophic. For those roles, testing is generally seen as proportionate.
Most people think screening is just about catching someone out before they start.
Yeah, the gotcha moment. But the sources highlight a longer-term value that's often missed.
It is.
Using those initial test results as a baseline measure for future health surveillance if the job requires it.
Ah, so you can track changes over time.
Precisely. It helps you spot potential issues down the line, allows for early intervention, maybe support. It's not just about catching people out.
So it becomes part of their occupational health record. Helps identify things that might affect their ability to do the job safely long term.
Right. And it can flag less obvious risks too, like how some common medications, antidepressants for example, might interact badly with alcohol.
A synergistic effect.
Exactly. That combined effect can be way more dangerous than either substance alone. Knowing this helps the employer make reasonable adjustments.
Or even advise someone that maybe a particular high-risk role isn't suitable for them based on objective data.
Yes. It reframes screening slightly. It's partly a health and safety tool, not purely disciplinary.
Okay, it's pre-employment. What about testing people during employment? What's the general view, say, from the UK's health and safety executive?
Well, the HSE view is generally that there's no need for widespread random testing across the board.
So reserve it for specific areas.
Yes. Primarily those safety critical sectors, again, armed forces, police, certain construction tasks like working at height, public transport. Outside of those, you need a very strong justification.
And legally, what's required to test an existing employee?
Consent is absolutely key. First, the possibility of testing needs to be written clearly into their employment contract.
Yeah.
Second, you must get their specific written consent before carrying out a test.
And I read something interesting here. Consent for alcohol testing doesn't automatically cover drugs.
That's a really important legal distinction. They are separate. You need explicit consent for each category you intend to test for.
Good to know. And what if you suspect someone is misusing substances? Can you test just them?
Yes, employers can generally target testing if there's a noticeable decline in performance or behavior, and they have reasonable grounds to suspect substance misuse is the cause.
But it has to be based on observable evidence related to their work.
Correct. It can't just be a hunch. It needs to be justifiable.
Okay, we've laid out the policy structure, justified screening in some cases. Now for the really critical part, the drawbacks. Why testing often doesn't deliver what people expect.
Right. This is where we need to look closely at the science and the practicalities. The biggest issue is often called the time lag problem. A positive drug test usually only tells you about past use. It doesn't necessarily tell you if the person is impaired right now at the moment they're tested, or, more importantly, while they're working.
And that gap between use and impairment varies hugely, doesn't it? Say, between alcohol and cannabis.
Massively. Alcohol is water-soluble. Its levels in blood or breath correlate reasonably well with current intoxication. But many drug compounds, especially from cannabis, linger in the body sometimes for days or weeks, long after the actual impairing effects have worn off.
So using standard urine or blood tests for drugs, it doesn't really tell you if someone's unsafe to work at that moment.
Often, no.
Yeah.
It can't reliably detect current intoxication or prevent an imminent accident. It also doesn't really stop people using while at work between tests.
So if real-time safety is the goal, what's a better approach?
Well, the research suggests focusing on performance itself. Testing things like reaction time, coordination, cognitive function, measures that directly reflect someone's current ability to perform tasks safely. That's a more accurate indicator of present impairment.
That makes sense. And there are other gaps too, right? Testing before a shift doesn't catch use during the shift.
Exactly. And testing someone today doesn't stop them using tomorrow or even later the same day after the test. The actual impact on day-to-day safety can be quite limited.
It could create a false sense of security.
It could. Plus, the system can be gamed. People wanting to pass a pre-employment test might just abstain for a short period beforehand.
Right. It doesn't necessarily change long-term behavior.
And then there's the risk of false positives. That seemed quite significant in the sources.
It really did. What causes them?
It's surprisingly common. Everyday things, certain legal medications, even some foods or supplements can apparently mimic the chemical signature of illegal drugs on standard tests.
Wow. So someone could be flagged incorrectly.
Absolutely. And that creates a huge risk for the employer. Wrongful dismissal claims, discrimination cases, all based on potentially flawed test data.
Which leads to what the sources call the optics trap. Testing looks good, but...
But it can be very expensive, potentially ineffective for real-time safety, and, as you say, sometimes it feels like it's done just to show something is being done. Political expediency.
While giving maybe a false impression of safety and potentially harming innocent employees if there's a false positive.
Which completely undermines all that effort spent building trust with the working party earlier.
And the legal landscape is changing too, isn't it? With cannabis legalization, medical use.
Yes, that's creating real conflict. Random testing policies can clash directly with legally prescribed medical treatments in some places.
You could have someone test positive for something they're legally allowed to take.
Exactly. Instant headache for HR and legal. Plus, overly strict random testing might actually make it harder to recruit good people, especially in fields where talent is scarce. Potential candidates might just go elsewhere.
Okay, let's try and pull this all together. For you listening, the key takeaway seems to be this. Putting an effective policy in place isn't just an HR task. It's a deep, strategic process.
Definitely. It needs that top-level backing, but also that thorough audit of the workplace culture and systems, digging into things like stress levels and, yes, even lunchtime drinking habits.
And while pre-employment screening has its place, especially for high-risk roles and collecting baseline health data,
Relying only on drug and alcohol tests for ongoing, day-to-day safety is tricky. Big issues with timing, accuracy, and that crucial difference between someone having used a substance versus being impaired right now.
so the bottom line seems to be companies might be spending a lot on tests that show past use when maybe focusing on the workplace environment itself, the culture, the stress factors could be more effective.
That's certainly what the source material suggests. Policy success seems tied more to worker involvement and tackling the root causes in the culture, rather than just the test results themselves.
Which leaves us with a final thought for you to ponder.
Given how common false positives can be, and the growing conflict with legal drug use, like for medical reasons, the real challenge for employers isn't just can we test legally.
It's more. How can we ensure safety in those critical roles while also avoiding unfairness or even illegal discrimination based on a test result that might be wrong or stem from perfectly legal behavior?
That's the tightrope they're walking,
Right.
and likely will be for some time.
A really complex challenge. Thank you for joining us for the deep dive.